The cancer doctor who subjected more than 500 patients to unnecessary treatments got a small show of support today. Two former patients asked a federal judge to be lenient tomorrow when he sentences Dr. Farid Fata. Prosecutors have asked for a sentence of 175 years. Dean Reynolds is following the case in Detroit.
In court today, awaiting his sentence, Dr. Farid Fata sat a few feet from Monica Flagg, his former patient, whose case is one of many now sending him to the penitentiary. Fata told her she had bone marrow cancer when she did not, and put her on chemotherapy he said she would need for the rest of her life.
I have never heard of something like this in my lifetime. I don't know if you have.
So Mongley, a native of Burma, was working for Fata as an oncologist in 2013 when he met Mrs. Flagg, read her medical chart, and shook his head.
There was nothing really to support that the patient has an active cancer.
Did you ask her who diagnosed her disease?
I think in a very sarcastic way, because I know who did. Yes, I was enraged, so I asked her the question.
You were enraged?
Correct.
He'd had misgivings about his boss before, a disorganized assembly line of patients and a reckless use of chemo. Monica Flagg's case was just too much. Days after Mongley reported it to a superior, Fata was under arrest. More than 500 patients had been victimized with chemotherapy they didn't need or expensive doses far too extreme for them to handle.
How did it feel when you heard he got arrested?
I feel very satisfied that at least this has stopped. I think he is guilty of the most cruel thing that a human being can do to another human being. I'm trying to be a very forgiving person, but that day is not today yet.
Prosecutors say it was all about the money, Scott. Dr. Fata abused his patients so he could fleece Medicare and private insurers of some $34 million. He has pleaded guilty to multiple counts of money laundering, conspiracy, and health care fraud, and he will be sentenced tomorrow.
Dean Reynolds with the key interview tonight. Dean, thanks very much.